Good morning, everybody. A very warm welcome to this, the second of our meetings of the all-party First Do No Harm parliamentary group. And I have to say, it's so good to have the patients with us, their groups and their campaigners, fellow parliamentarians, of course, and many, many others joining us at this meeting today. So thank you for coming. Thank you also for those of you who attended the virtual launch. But I just want to say for those who weren't able to do that, the minutes are available on our website. Today, I'm delighted, really delighted, that we're joined by the Minister for Patient Safety, Nadine Dorries. Nadine, I know that you have a diary that must be extremely challenging, and thank you for finding the time today to join us. It's really good to have you, and we look forward to your opening remarks and, of course, the questions that people will put to you and your answers for those. My fellow parliamentarians and I are on screen throughout today. Others here will not have their cameras and microphones activated, but we do have a Q&A function. So I would like you to ask a question and to use that function. We are going to get through as many questions as we possibly can in the 45 minutes that are available to us. So, of course, short questions are very much preferable. Today, we're joined by three vice chairs, members of Parliament, Emma Hardy. Emma, there you are, I can see you. And Yasmin Qureshi, who I've said hello to, and Shara Hodgson. Also, we've got Alex Norris, MP, Dr. Julian Lewis, Baroness Finlay, and Baroness Thornton, and Lord Alton. So welcome very warmly to all of those. I'm also joined by members of the review team, Sir Cyril Chantler. Cyril, hello, good morning. And Simon Whale, who was also a member of the three-panel team. And then Dr. Valerie Brass. Valerie was our very hardworking and extremely efficient secretary. And with Dr. Sonia MacLeod, our chief researcher, on the whole, they were the people who actually wrote the report, though of course we all had an input. Jeremy Hunt, the co-chair of the group, has asked me to give you his apologies. He's unable to come today because he's got committee business. Cat Smith, MP, Lord O'Shaughnessy and Lord Patel have also sent their apologies. Now, since the group met, an awful lot has happened. On Thursday last week in the House of Lords, we debated yet again the Medicines and Medical Devices Bill. The bill, of course, started in the Lords in November, having been passed to us by the Commons. And it's coming back to the Lords very shortly with the comments from the Commons. I have to say it was a really happy coincidence that the bill did come to the Lords, because it gave me an opportunity to put down a whole range of amendments, both in the committee and the report stages, always referring to our report, First Do No Harm. Now, I was absolutely delighted that many peers had read the report and they knew of our 9 recommendations, and they couldn't have been more supportive and generous in recognising the importance of the report and its implementation. And they welcomed the opportunity to incorporate into the bill the safety measures and the mechanisms that we set out in our report. The Lords Minister, Lord Bethell, recognised the strength of feeling. And although we have a very long way to go yet on other recommendations, we have made progress in that the ministers and their officials, and I have to say they really have worked their socks off, They've agreed with us to establish the Patient Safety Commissioner. And of course, it's now in statute. It's in the law of the land, and I am thrilled. This marks a great victory for campaigners. And throughout the bill, we related their stories, we quoted them, and without a doubt, it was they who have consistently involved their MPs to put pressure on ministers. And ministers have listened. And so thank you, Nadine, and your colleagues for understanding the importance of the Commissioner's role and the urgency to get it up and running. The recommendation for a redress agency was very much debated and discussed and supported by peers. I expect, Nadine, you will cover some of that, but I have to say we were disappointed to read in the Minister's written statement and also to hear from Lord Bethell during the debate that the government has no plans to establish a redress agency. We think we do need a better way of ensuring that people who suffer avoidable harm in the future can access the redress they need. Going to court, we know, is expensive, it's difficult, and it's stressful. And it hasn't really delivered the results for patients. So I hope the government will think again about the case for a redress agency. But that, of course, is for the future. For now, we urgently need 3 separate schemes for hormone pregnancy tests, for valproate, and for pelvic mesh. But I am encouraged that our proposals remain under active consideration and that the government does have sympathy with this notion that these schemes will offer families much needed help and support. And I look forward, Nadine, to what you've got to tell us on that. Now for an update from the Minister. Nadine Dorries is the MP for Mid-Bedfordshire, and she was elected in 2005. She has 3 daughters, is a prolific writer of fiction, and was a former nurse. She's been very active as a Minister of State since 2019, and her responsibilities, I have to say, are numerous and very wide-ranging. She has 3 important elements to her ministerial title: suicide prevention, mental health, and patient safety. Now, last year, she sent a very strong message by putting patient safety first in her title. And that indicates how important this area is to her. She's joined us today to provide an update on the government's thinking regarding the review's recommendations. So for those of you who didn't see it, the Department of Health and Social Care published a written statement from the Minister 2 weeks ago, for which I really want to thank her and her officials. So we welcome the statement. It's provided us with valuable detail on the government's thinking. It also raised a number of questions which my fellow parliamentarians and I have been discussing over the past week, and I'm sure others who join us today also have questions on the subjects. So we'll get to those questions in due course. But first, Minister, I'd like to invite you to say a few words to us. Welcome and thank you.
Thank you, Julia. I've never been introduced before as a prolific writer of fiction, but thank you. I'm afraid I haven't been able to do very much of that lately. It's all my old work that's being recycled, but thank you, Julia. And obviously, I'm delighted to join you here today at the first full meeting of the first Do No Harm APPG. As Minister for Patient Safety in the Department for Health and Social Care, you're quite right. One of my first priorities has been patient safety, and I did, when I was promoted from POS to Minister of State, request that patient safety be put at the top of my portfolio. In my initial small way of wanting to make sure that everybody got the signal and understood the message that before everything else, patient safety must come first. And this particular review, which you have undertaken, has been a personal priority of mine within the patient safety portfolio. And I'm really delighted to be able to be here today to update you on our current thinking and the work that we have done and our ambitions for the future. And I'd just like to thank you for recognising also the work that the officials have done on this report in the time of COVID. It's I don't think I need to explain to you what life has been like within the Department of Health and Social Care over the past year, but it has been incredibly difficult indeed to have been hit with a pandemic. But despite that, the officials have still managed to give this report their attention and to, I believe, do it justice against the immense, huge pressures they are under in terms of work demands at the moment. And so I'd like to echo your thanks to the officials, because without them, we would not be at the point that we are now. I'd also like to say thank you to my parliamentary colleagues who are members of and leading this APPG, yourself, Baroness Cambridge, and the work that you've done and the undertaking that you took when you took this report on, this review on, and the absolute personal commitment you have given to it. I am aware of that, and I hope everybody else is. You've been absolutely dedicated to this review from the day you took it on. And I add to that Jeremy Hunt and Lord O'Shaughnessy, Lord Patel, Lord Hunt, and Sharon Hodgson, who I know's own mum gave evidence during this review and inquiry. Kat Smith, Yasmin Qureshi, and Emma Hardy. Thank you all, because it's such an important subject, and without your backing and your commitment to this, it would be all the harder. So thank you very much. I'd like to pay particular thanks to Jeremy, who, when he was Secretary of State, not only commissioned the review, but initiated important work on prioritising and improving patient safety across the whole of the health and care system. And I'd also like to add to thanks the Baroness Cambridge and your team for their continued dedication to ensure that the report commands the attention that it deserves. And, you know, so quickly on the review, the medical devices bill going through the Lords, which was very fortuitous at that time. You know, it's been huge work, a huge amount of effort in driving forward action related to the report's recommendations to get to the point where we are today, which I think is in a good place. And finally, but not least at all, I would like to thank the women and their families who have contributed to this report, some of whom will be, I hope, present today and will be listening today. Your tireless work, your bravery in coming forward is testament to your commitment yourselves to improving patient safety across the healthcare system. You have more than done your bit in shaping the recommendations of this report and getting us to where we are now. Your stories have a significant impact on me and many others, and they will not be forgotten. And they certainly haven't been forgotten by me, because in almost every issue which arises in patient safety now, I quote your stories, I quote your experience of not being listened to and not being heard. I sometimes add at the end, and that's because they are women, but I quote this report frequently since it's been written. And I want you to know that you are not only shaping what happens in this review, but in other work going forward within the department on a daily basis. In my role as Minister of State for Patient Safety, I regularly hear from and meet with people who have been affected by the issues of patient safety. And as Baroness Cambridge has outlined, their stories all have common themes of suffering avoidable harm, of not being listened to, and of a system that is difficult to navigate when things do go wrong. And sadly, these issues, as I've just said, are not unique to the Cambridge Review. Along with its individual recommendations, the report also poses the central question of how the health and care system listens to patients, and as I've said, and as I frequently say, women in particular. We must not forget that the Cambridge Review, alongside other independent inquiries, were commissioned because women did not feel that they were being listened to. And it is absolutely essential that this must change. And I hope you don't mind me adding on here, particularly in the area of maternity safety. It is essential that this must change. We need to double down on existing efforts to put the patient voice at the heart of patient safety and ensure that the health and care system always has a compassionate and a responsive approach. I am confident that our acceptance of recommendation 2 in the report, the establishment of the Patient Safety Commissioner, will play a key role here in helping to strengthen patient voice and have influence across and throughout the system. Our commitment to patient safety, however, is not limited to the Patient Safety Commissioner. I am sure many of you have read the written ministerial statement published on Monday, the 11th of January, which updated Parliament on the government's current progress regarding the review. And I'll not go through the details of the statement today, but I hope you will agree that our progress on several of the recommendations is testament to the government's renewed focus on the vital importance of listening to and acting upon the concerns of patients. For example, government has accepted recommendation 7. We have acted to amend the Medicines and Medical Devices Bill, which, as Julia highlighted, has recently passed through the law in the Lords into statute, to create the power to establish a UK-wide medical devices information system. This system will mean that in future, subject to regulations, we can routinely collect medical device, procedure and outcome data from all NHS and private provider organisations across the UK, ensuring that no patient in the UK falls through the gaps. The government also accepted recommendation 6. Patient safety is the MHRA's top priority, and the MHRA recognises that the major changes highlighted by the report cannot wait. The organisation has already begun a substantial programme of work to improve how it listens to and it involves patients in all aspects of its work. To reform systems for reporting adverse incidents with medicines and medical devices, and to strengthen the evidence base for its regulatory decisions. I want to assure you that patient safety remains a key priority for the government and for the whole of the health and social care system, and never more so than at this unprecedented time for the NHS and for the whole of our society. Patient safety runs through everything we do to tackle COVID-19, and as Minister of State for Patient Safety, I have drawn deeply on the lessons set out in this report to inform my priorities for the year ahead. I understand that many of you will be keen to know when we plan to publish a full response to the review and the government's thinking around the continued implementation of recommendations. Firstly, let me reassure you that we know that further action is needed to ensure that we help those who have already suffered and reduce the risk of harm to patients in the future. But we will not do this alone. We absolutely recognise the need for effective patient engagement in order to rebuild trust. As I outlined in the written statement, we are establishing a patient reference group, which is part of Baroness Cambridge's 9th recommendation. The group will be made up of patients and patients' representatives, including those involved in the review and those with a wider interest in patient safety. It will be facilitated by an independent organisation and chaired by a patient representative. The group will meet regularly and will work closely with the department to ensure that patients' voices are heard as we move towards a full response. I can confirm that the recruitment group for members is open. Recruitment for group members is open. And I would encourage you to circulate the opportunity to your own networks and to those that you know have a particular interest in this area. Officials will be happy at the end of this call to circulate the information after today's events, if you do not already have it, and you know of patients or patient groups that you feel would be interested in being a part of the patient's representative panel. I hope that you will agree that a great deal has been achieved in a very short space of time, despite the pressures of COVID-19 pandemic and the adverse conditions that we have been working in over the past year. But I understand that we cannot be complacent. The Cambridge report is a document that vividly shows the importance of patient safety and the tragic consequences when it is not followed. We owe it to the victims and to their families to learn the lessons and to make sure everyone gets the care and the protection that they deserve. I look forward to answering some of your questions today and working with this APPG as we take forward this very important work. Thank you.
Nadine, thank you so much. I mean, there is no doubt that the government really is very, very focused on patient safety, albeit I know you're so right, the coronavirus has really taken a tremendous toll on people's time and effort in government and throughout the NHS, and indeed throughout the whole of the healthcare system, and I include regulators and others in that. I just want to ask you one question, because you've suggested that the 3 schemes that we want some redress for is under consideration. And I just wondered, when we were talking about the Patient Safety Commissioner, it was really interesting that the Bill team and other officials were extremely really good in asking us our views and to help draw up the Patient Safety Commissioner, the role and what was required, etc. And I wondered if you would perhaps accept an offer from us that we could help the government in their consideration of the 3 schemes for redress. I wonder what you feel about that.
Well, Julia, I think you and I know and understand each other, and I think we both appreciate absolute honesty in our conversations about this. And on the basis of that, I am going to decline your offer. And the reason why is that there is no example of an independent review then moving into the governmental arena of shaping the work that is moved forward. That is the responsibility of the elected government. And whereas your report has been absolutely digested, and we are always open to additional suggestions. But the role of the review was to do the work you have done so well, to produce the report, but it is now the job of the elected government to move ahead and to implement that within the workings of the government, of the elected government. It's just not standard practice for independent reviews to take forward the outcome of the conclusions. In a way, Julia, that would almost remove the neutrality of the work that's undertaken moving forward. And, you know, I know that if I fudged around this and made you false promises and said, yes, you know, we will see how we can, you know, the usual answers that I could give you. I'm not going to, Julia. I'm going to tell you actually quite bluntly, the answer is no. But that doesn't mean that we can't discuss it. through the forum of this APPG. That doesn't mean that conversations won't happen moving forward, but the bottom line is that your team have conducted the review, you've made your recommendations, now it is our job as an elected government to take those recommendations forward.
All right, thank you very much. Disappointing, but quite understand. Perhaps I could now ask the parliamentarians if they have got a question to ask. Yes, Yasmin, and then David, and then Alex. Yasmin. Yasmin, are you muted? Will, is it possible for you to unmute, please? Will? Simon, we're all muted. Can you unmute those who want to speak?
I think Emma can speak. Emma's unmuted. So should we go to Emma and see if we can get back to Yasmin?
Thank you. Thank you so much, Baroness, and thank you, Minister, as well, for coming to talk to the group. I'm obviously disappointed about the redress agency, but since that's been covered, I want to put that to one side for now. I've been talking very closely with Kath Sanson, who's absolute incredible woman, gave evidence for the on vaginal mesh and has been campaigning for years for justice for women who've been harmed so badly by a mesh, and runs the Sling the Mesh group and campaign. And I urge you, Minister, to reach out to her and include her going forward in having that patient voice. Now, so I'm going to use the comment that that she sent me, which I sent on to the Baroness. She's put that she's being informed that the specialist treatment centres will be unlikely to be ready to launch in April 2021. And further, there is no agreed treatment regimes, meaning that the treatment offered depends on the centre attended, not the complaint itself. And what we're hearing is that some treatment centres are going so far as to deny mesh is a problem and encouraging the use of Ovestin estrogen cream to thicken vaginal wall tissue to cover mesh erosion. So we're concerned really that the treatment centres are still not all recognising that mesh is a problem. So there isn't that consistency in the way that women are being treated. And this fear, and totally understand about, we are in a pandemic, but this concern about how the specialist treatment centres will not be ready. And I just wondered if there's more the government could do to really, push forward on the concerns that we have around the use of vaginal mesh and their treatment. Thank you.
Right. Nadine.
Hi, Emma, and thanks for that question. Sorry, could you give me the name of the patient again?
Kath Sanson.
Sorry?
Kath Sanson.
Kath Sanson.
Yeah, she runs Sling the Mesh. She's incredible woman. Unfortunately, is working, so can't be here today.
Okay, well, Emma, you've advocated really well for her. I don't know if you have the details of we are setting up, as I said in my speech, a patient panel, and we want it to be chaired by a patient who will, in a way, oversee and inform us on the implementation of recommendations and provide a two-way information. So on what's happening with the treatment services across the UK at the moment, NHS England is actively in discussions with trusts across the UK about how we take forward the recommendation to establish treatment services. Now, that information that you've just given me is vitally important. It's kind of the granular information that we need to get down to as to what's happening to women on the ground, what they're being told. Obviously, it needs to be verified by patient records and by the trust, and because we just can't take anecdotal evidence. But Kath sounds like exactly the kind of person who should be, if not applying for the chair of this patient panel, a part of this patient panel. So I will, if officials are on the line, if you could make sure that that Emma has the details, so that she can pass them on to Kath, which I hope you will, and also provide the process by which Kath can be part of the ongoing patient panel, because that's exactly the kind of information that we've got from the report, from the witness statements, but actually moving forward. So the report took the situation to a point. Now that we are moving forward, we need to know information like, you know, are the treatment centres going to be working? Are the services tailored right? Are they being administered right for the problems that women are being presented with? And that's exactly the kind of information that we need. So please pass her the details, Emma, and if she becomes part of the patient panel, which please urge her to, because it sounds like she's exactly the kind of person who should be, if not the chair of it, then please make sure she gets in touch with us and we can work with her going forward.
We got quite a lot of questions about hysteroscopy, and one from Catherine Talco, who says, please will the Minister for Patient Safety meet with the campaign against painful hysteroscopy? So I don't know, Nadine, if you would be willing to do that.
I think I've written to them recently. No hysteroscopy should be painful. All women should be offered pain relief before an hysteroscopy. And I am very sure that I have written to them, but we will look into that. I'm sorry, I should add to Emma. Emma, I can't guarantee that if we have a large number of people applying to be on the patient panel, I can't guarantee that everybody will be accepted. So I just want to put that caveat in. So Julia, I believe that I have written to them just recently, and I'll ask officials to look at it. I mean, the bottom line is that no woman should have to suffer pain in order to have any procedure undertaken. And I believe that there has been a practice by some doctors to offer women hysteroscopies without pain relief or without twilight sedation or other sedation. It seems to me that twilight sedation is the perfect sedation for this kind of procedure, but I'll get officials to look at it further.
All right. Well, I think they'd love to meet you, and I know that you're...
Julia, I will obviously try. We received dozens, if not sometimes hundreds of requests for meetings at the moment. And the problem is with COVID, we simply I just don't have the working 7 days a week is as much as I can do, I'm afraid.
All right. Thank you. Lord Alton, David, I think you wanted to put a question.
Thank you very much, Julia, and thank you, Nadine, as well, for coming to speak to the APPG. I hope we'll hear from Yasmin. I serve as Vice Chair of her group on hormone pregnancy treatments and tests. And it's 11 years, Nadine, since I raised with your department the issue of Primados. I'd like to know whether you agree with Julia's report's conclusions that when the first comprehensive study in 1967 identified a link between congenital abnormalities and HPTs, Primados then should have been removed from the market, and that this regulatory failure has seen justice delayed, but also in the way that this has been dealt with it. If it hadn't been for Julia's report, justice would also have been denied. And what I'd like to know from you, Nadine, is whether there will be an independent re-examination of the now contested expert working group's report conclusions, and in implementing the Cumberland's recommendations without delay, what practical help and redress will be provided for families whose lives were irreparably blighted by Primados. Thank you, Nadine.
Nadine?
Thank you, Lord Alton. And as you know, the review looked into into detail over the issue of Primados. I'm restricted, actually, as to what I can say about Primados for a number of reasons, not least, I believe there is a legal action in process. But I would like to make it clear that the government's position regarding a causal association between hormone pregnancy tests and the adverse outcomes in pregnancy. The scientific evidence has been reviewed on a number of occasions, most notably by the Commission on Human Medicine's expert working group, EWG, on HPTs, who reported on the findings in November 2017. And the EWG concluded that the available scientific evidence did not support a causal association. And this remains the department's position at present. The review did not seek to the scientific evidence to date, and the focus of the review is to look at the robustness of processes used to look at issues raised around the interventions of Primodos, sodium valproate and vaginal mesh, and the quality about the engagement and the coordination. We need to, and Primodos came into that group, but I'm afraid the department's position, I am not an expert on Primodos, but the position of the department and the scientists within the department remains that there is not a causal link. But I do know that, and you know, I'm sure that there is further work going on this. So we will wait and see. But at the moment, I'm afraid I can't give you a more satisfying answer.
Right, well, thank you. I'm just going to mention a question that's come from Michelle Moffat. Michelle highlights the new study that's been produced on pelvic mesh erosion. And the results, she quotes, the results produced show that all the commercial products tested were capable of eroding tissue at a significant rate. And she's asking, in the light of this new evidence, will all mesh use be suspended until further research is concluded to ensure mesh safety? I don't know if you'd like to answer that, Nadine.
Hi, I think there are people for who I believe mesh is still the answer to their particular problem, particularly with the use of male mesh for inguinal hernia. But I will, again, could I just ask that Michelle, also as someone who has a particular interest in the area, is pass the details of the patient group. The current pause in the use of vaginally inserted mesh to treat women and the use of the tape or the sling to treat stress, urinary incontinence consists of a high vigilance programme of restricted practice to allow the NHS to move towards a consistent, high quality service that adequately meets the conditions set out by yourself, Julia, and your report. And a blanket ban was not recommended, Julia, and so there need to be some exceptions within this pause. And I think the answer to the question yourself, Julia, to Michelle would be that we can't have a blanket ban because there will be exceptions and there will be cases where this is needed. And so I suppose the answer to Michelle, I hate saying no to, I hate saying the word no, but I hate saying no to Michelle as well, but I'm afraid it wasn't your recommendation, Julia, and we concur with you that there will be exceptions, there will be women to who this is the only answer and the only treatment available, and therefore we can't blanket ban a treatment which will provide some solution and recourse to some women and to men.
All right. Thank you. Yasmin, I hope you're...
I should add to that, by the way, that the review of the pause will not preclude any new evidence going forward. I am aware that we're at a point in time with your review and that things will continue to move forward, as the same with my answer to Lord Alton. Time doesn't stop. The review of the, continual assessment of the pause on review and the use of mesh, the pause on mesh and the use of mesh, continual evidence being brought forward on Primodos. because your review is being published doesn't mean we stop looking at those particular conditions, problems, issues moving forward. The work still continues. We still continue to listen to and take evidence from patients and from scientists. So we will continue to review, obviously.
Yasmin, very quick one.
Yes. Can I just ask a very a quick question, which is, when the department is going to be considering the issue of compensation for all the different victims, will they be also considering the address of compensation for the Primados victims? Because if I can just explain a little bit, I know that, Minister, you're not able to comment, but we want to actually be able to explain to you the victim side of things. And essentially, the victims have never accepted the recommendation of the EWG, and there was a big debate in Parliament about it, where many parliamentarians across the chamber unanimously condemned the expert working group. So you may be getting the department lawyers and officials saying this is one side, but all the parliamentarians and other people and the victims and the patient group who had to deal with this report, EWG, found it unanimously. Everybody said that it was not done properly and that its findings were flawed, and the recommendations even at the last minute were changed for what was happening. So we actually questioned the actual EWG. Now, again, I understand you're not able to comment on it, but it seems that the whole attitude towards Primados seems to be based on the EWG, which has been thoroughly, as far as we're concerned, has actually been criticized, and we don't think it's worth, in fact, the piece of paper it's written on. So we need to be able to have a chance to speak to you about this, so you can hear a counter argument as opposed to what the officials are giving to you. Now, coming back on to the legal case, I know you said you can't speak because of the legal case. The first time I raised this last summer when the review came out about the Primados, it is because of that reason that they've had to kind of go down the legal route. I know, and they can have this conversation with you completely, as I said, without any kind of legal liabilities attached to it, to explain that they would be happy, and I've got a statement from the solicitor saying that they're happy if there's redress agency or something being set up for compensation for other people, they're happy to work with the department on that compensation scheme. And if that happened, any legal cases will be dropped. And of course, as you know, Minister.
Yasmin, I think you've actually outlined it very clearly. So would you like to respond, Nadine?
Thanks, Julia. Well, obviously, I cannot comment on live litigation, which is taking place at the moment. And, we have accepted, ministers have accepted the Commission on Human Medicine's advice that there is, I know this is my disappointing answer to Lord Alton, that there is no causal association between the use of hormone pregnancy tests and birth defects. And, that, I know this sounds harsh, that does not take away the fact that very real suffering has been experienced by families. And I would just say that the recommendations on redress for sodium valproate, mesh, and the HTPs, Primados, I'm afraid I just can't be drawn on individual components, issues around the issues that Yasmin raised around compensation. I just can't be drawn on those. No, we are not going to set up a redress agency, as you know, Julia. But recommendation for the redress agency does remain under consideration. And I don't know, Julia, whether you think it is an appropriate point for me to mention the redress agency and perhaps reasons why we're not accepting recommendation for. Cut me off if you think it's not. You don't want to hear the reasons why at this particular point in our short time. But we don't believe that a redress agency will give us the answer that we want at this particular point in time, and in the way that it has been recommended. But we are looking in the department at this whole issue of redress. We are the whole hopefully later in 2021, later this year, and we're going to bring forward some recommendations and some ideas on this. But the redress agency as proposed in recommendation 4 is not something we're going to take forward at this time, but in view of our wider considerations being undertaken at the moment, it will be under consideration and considered. I hope that's subtle enough and acceptable to you, but we just don't believe a redress agency on its own, working with the other functions that we have across the health and care sector at the moment, will actually work. What we need to do is make what we've got out there work better, rather than adding more to it. So at this point in time, it's a no to the redress agency, but that doesn't mean that it's not under consideration and we're not thinking about the recommendations that you made going forward in other work that's being taken forward in the department.
Right, well, thank you for that. Last question. This is from one of our supporters, Sharon Craddock, who says, please, vaginal mesh is not the only issue. And she talks about that, did you know that patients are still receiving mesh on high vigilance and being told that it's not the mesh in the news? Our group sees ladies who've recently had this mesh and are having issues already. So I don't know, Nadine, if you're aware of that, but clearly this is an issue. And we will be sending you all the questions that have been asked today, but we're getting fairly near the end. And I'm just finally going to ask Sharon Hodgson. Sharon, you've had your hand up for quite a while, and I apologise for that. Would you like to put your question, and then I'm going to close the meeting?
Thank you. Yes, thanks, Minister. I'm just sitting here thinking, what would my mum ask, and what would my mum want me to ask if she was sitting on this call? And someone called Jackie Shaw in the Q&A is asked the very same thing. About Jackie Shaw's question says, the centre set up in 2017 have pro-mesh surgeons who are dismissing patient issues. Will the new centres allow surgeons chosen by patients? Trust is a massive issue for those of us who've had issues. Now, my mum wants to know when. I mean, she's 76 and still shielding from COVID and getting her first vaccination soon. When will she be able to have this mesh removed? When will there be a centre in Newcastle open that isn't ran or by the surgeon who put her mesh in, who she really doesn't want to be the one to go to discuss having it removed? This is a major issue. So, you know, she doesn't want to kick in. She would like to sort of, once she has the vaccine, to be able to then get this mesh removed and be able to start a life again, which has been on hold, it seems, for years now, and the pain is not going away. She doesn't just want to keep taking painkillers. She wants to have this, you know, awful mesh out. So when, you know, have you got any dates for these specialist centres, and when will we find enough surgeons who are trained in the removal to do that work?
Nadine?
Sharon, and best wishes to your mum as well. And I know she's been through a lot personally. Obviously, I can't comment on individual cases, circumstances, or actually even individual treatment services. But what I do know is this, that the NHS is working very closely with Trust at the moment to set up those services that will be guided by the recommendations, the high quality service recommendations that were listed in Julia's reports. And I believe that NHS England is hoping to make a recommendation by spring of this year as to where those services will be across the country. I don't know, I can't comment, obviously, Sharon, on which surgeons each centre will employ, whether in Newcastle it will be the one who originally did the operation on your mum. All I can say, Sharon, is if that is the case, then you need to go back to your trust, probably to the CEO of the trust, and say that that isn't the service that your mum wants. but I can't, and I can understand there is a breakdown of trust between your mum and that particular surgeon, but that's something you'll have to deal with going through the trust in Newcastle. But in the wider, answer to your more substantive question is, work is going on to establish the centres. We hope that an announcement will be made in the spring. NHS, even in spite of all that's going on in COVID, and believe me, there are very few spare souls in the NHS to work on things like this at the moment. It is being worked on, and they do hope to be able to make the announcements in the spring. I actually cannot guarantee that there will be a centre in Newcastle because it's out of my hands. It's into this goes from the department into the NHS's hands. We tell the NHS that they have to set up the services, that they have to be high quality services, as dictated by Julia's report. They have to be set up, a number of them across the UK, but we can't in the department dictate exactly where they will be. That is down to the NHS.
Nadine, I've just had some information from NHS England, and they are going to be putting out a statement on Friday about the new centres, so that will be interesting for people. They will be saying where they are going to be situated. And also, I think it raises all sorts of questions that Sharon, I'm sure, would want to know. You know, how are these people going to be trained? All sorts of other issues will come up. So perhaps we could be in contact with you when that does occur. So
Okay, well, I apologise for not knowing that. It is not unusual for the NHS to make announcements and not tell ministers or the department.
Can I say it was a personal call that I made. And also one to a surgeon who I knew was involved in this. So I'm sorry, I didn't mean to bounce you or anything like that. You know, you have a huge portfolio.
Yeah.
So, so anyhow, I think that's going to be a real interest to a lot of people, that they will know where these centres are going to be established. But as I say, I'm sure there's a lot of other questions that will be related to it.
Well, so, Julia, we will take, I think, officials, if you can get the questions to any, if you can group the questions into subjects and to get them over to officials, I'll try and get the questions answered in the time outside of this call. Obviously into subject matter, that would be, we were happy to, I don't want anybody to go away. I haven't been able to read the Q&A while we've been taking the meeting, but we will do our best to answer the questions.
Well, thank you. That's a good one. And I know that Julian, I'm sorry, Julian Lewis, I haven't got to you yet, but thank you very much for coming. And also our other parliamentarians. And I do apologise to all those, lots of you who've asked questions, and thank you very much for those. It's always time that's our enemy, and haven't been able to answer all those. But Nadine, I particularly wanted to thank you because I know that you, as I said, you've got a diary from hell, I should think, to find the time for us, and very grateful to you for that. And we will, of course, be taking a huge interest on the recommendations that are not going forward, and particularly those that are. And I should say on the Patient Safety Commissioner, clearly there's going to have to be a lot of work before that person is in post, and how they're going to be appointed and all the rest of it. You know, I don't want to raise false hopes, but we need to get on with the job because, as you said in your speech, and thank you for that, it's really important to have this person in post. So thank you all very much, parliamentarians and all those who've asked very incisive questions. And we will certainly try and respond, or we will send them to the department so the department can respond. And I'm sure people will then be more satisfied. So very grateful, thanks for everybody, and to those who've organised this meeting, because it does take a lot of doing, I know. I wish you all the very best for the next, well, indeed, we will be having more meetings, obviously, and they will be notified to everybody as to what we're doing, because the purpose of this group is to get our recommendations implemented. So thank you all very much indeed, especially Nadine, and farewell. Thank you.
Thank you.
Bye, everybody.
Thanks.
Thank you.
Thanks, Julia. Thanks, Nadine.
Thank you.
Bye,
Thank you. Thank you.